So hi everybody, thank you for joining today. And my name is Candice. I would like to share a day in the life of a community health nurse. So a little bit about me. So I received my Bachelor of Nursing degree, BSN degree at the Seattle Pacific University back in 2018. And now I'm actually currently receiving my Doctor of Nursing Practice DNP degree in Family Nurse Practitioner track, and will be graduating in 2 months this year. And I work as a nurse in International Community Health Services. Outside of working as a nurse there, I also am under a team called Clinical Informatics Team, and what we do is we help support the electronic health systems and also review clinical workflows. So I am one of the nurse representatives there. And in terms of leaderships, I am also part of the Pacific Northwest Chinese Nurses Association, and I am representing these organizations today, since I serve as one of the vice presidents there in these organizations. PCNA is a non-profit organization. We gathered Chinese nurses together, whether it's Chinese immigrants or American-born Chinese nurses in the community, and we hope to diversify the nursing workforce and trying to provide community events or services to the community. And why nursing? I love this list of reasons why I chose nursing, and I think it's really relevant to me until today. Current nursing workforce, it's in a demand. Nursing, there's lots of shortages in these professions, and nursing career also can be expanded beyond hospitals and clinics. You can work as a nurse consultant, you can work as a professor, nursing professor in a university. You can also have your own clinic when you become a nurse practitioner. So there's lots of opportunities and careers beyond hospital settings and clinic. And as a nurse, your schedule can be flexible, your location can be flexible in terms of travel, nursing, etc. And we have a great community. You will find nurses wherever you go. And I think this is just such a great community. And also the educational growth has been huge. There's bachelor degrees, there's associate degrees in nursing, there's master degrees in nursing, and also doctorate degrees in nursing, and variety of educational pathways to nursing. And it's a really well-respected role, and I think this job is very rewarding. We help patients, help people for a living, and these are part of reasons why I chose nursing when I first determining what should I do in the future. And why community health? The reason why I chose community health is when I was in nursing school, I got the opportunity to work in to just participate in different rotations, such as the hospital settings or pediatric hospital, like the children's hospitals or the clinic settings. I really love that I got to build relationship with patients in a community health setting. The goal to work in a community health setting is to improve the health of a community members. We really focus on the vulnerable populations, including low-income families, immigrants, people living in rural settings, individuals with disabilities. I just love that I got to build relationships with patients. I got to see them where they are family members, bringing their family member in, or themselves as patients, or patients themselves as parents. So I love that part. We get to promote healthy living, really focusing on disease preventions, and lead patients to the medical treatment that is necessary. And in community health, there's lots of settings, whether you can do public health clinic, school setting, or federally qualified health center where I currently work. And a little bit about Federally Qualified Health Center, FQHC. Community-based healthcare providers, we as the organization, we receive funds from HRSA, which is a organizations that provide health center programs to provide primary care services. And community health centers deliver more comprehensive, culturally competent care and really high quality of primary health care by providing educations or services like transportations or interpretation services. And there's something special about community health center that is sliding fee scales. We provide sliding fee scales for patients regardless of their ability to pay or charge for services. And generally, health centers usually have access to a pharmacy like on-site pharmacy or on-site mental health providers, substance use disorders, or dental care. So my typical day as a nurse, so I work for this organization, International Community Health Services. What my typical day looks like as a full-time nurse. So right now I'm not a full-time nurse because I'm in school, but when I was a full-time nurse, the schedule's typically like Monday to Friday, 8:30 to 5. You get to have a lunch break from like 12 o'clock to 1 o'clock or 1 o'clock to 2 o'clock, which is actually pretty big lunch break compared to if you're in a hospital settings. Your lunch break tend to be like way shorter period of time. Our clinics opens on Saturday, so I need to cover one shift per month. Something that is exciting about outpatient setting in a community health setting or primary care, you get to have holidays off. So I never need to work on Christmas Day, New Year's Day, Thanksgiving Day, etc. And who do I work with? I work with within a nursing team. We have 3 to 4 regular nurses and usually one OB nurse who take care of our OB patients. Other team members include providers, medical assistants, behavioral health providers, clinical pharmacists, nutritionists, care manager, case manager, social worker, and our very essential patient support representatives such as our front desk staff, our referral departments, our medical records team. So you work with a variety of team members, and team-based care is very important in within my role. And what do I do as a nurse? We do lots of things and every day is very different. And that's why I love about primary care community health setting. And I think it fits my personality really well. I love that I get to, just every day is very different. I get to see different patients. Today it could be lots of triages, or today can be a lot more of patient education visits. So things I usually do includes medication administrations. As nurses, we can administer oral medications or injections. We give lots of injections in clinics. For example, if your patient came in and see a provider because they have really bad shoulder pain, the provider may say, oh, I can prescribe a pain injection for the patients, like a Toradol injections. Then the nurses will be the one who give the injection to the patients. We do lots of triages, meaning that whether that is through the phone or in person, meaning patient call in with their concern, they probably can tell you like, I've been having a headache for 3 days. I have tried this, it's not working, what should I do? Or a patient can be calling in, patient's mom calling in saying, I have a baby, she is 2 months old, she's starting having diarrhea for 5 times a day, what should I do? So our job as nurses, we take those phone calls, or whether it's in-person visits, we need to determine what to keep our patients safe, whether we should have our patients see the provider today, if our schedule available, or whether we should tell the patient that this is more urgent. You should go to an urgent care nearby instead of waiting for 3 days to see a provider. Or if you identify more emergent situations, then this is a case of where you need to make the judgments, of course, under some provider supervisions or consultations and sending patients to the emergency room. So these are triages that we do, and every day is different. So you can get really variety of calls a day or visits a day. And personally, I think that's very exciting, and I love to help patients wherever they have a need. We also do wound care. Lots of patients come in, they have diabetic wounds or they have pressure ulcers. We do those wound cares. Abnormal lab results, that's a very big piece of my job, is also sharing lab results with patients, telling them what they can do to make lifestyle changes, or whether we can communicate a message from their providers, such as like, your x-ray shows that you have a fracture, you should go to see a specialist, or your lab result is concerning, you might need to go to the emergency room, etc. And lots of patient educations, whether that is through when you are talking about the lab results, or when you are teaching patients how to use a glucometer, or in insulin teaching. Also lots of care coordinations between offices. We call the specialist office, or we take calls from the specialist office, trying to keep our patients safe, or providing cares between offices. Also care coordinations between adult family homes or long-term care facilities. And my patient populations, I work with patients in a variety of ages, from newborn to end of life geriatric patients. I work with lots of immigrants, refugees, lots of low income families, lots of patients who also struggle with addictions and homelessness. And next, this is just very special pictures. It's just showing this. I'm right here. These are my team members. We are all nurses, and this is some members within my clinic. It is a very fun, rewarding opportunity, I would say, working in a community setting, just because you really meet lots of people wherever they are. And I love that about community health. And you might think, where, I don't know, the audience where you are at, you may thinking about what you might be in a nursing, you might be in high school, or you might be in early college career, you're thinking about nursing, but you're not so sure what to do and wanted to think about like your future plans. I suggest you to explore, talk to different healthcare professionals, talk to them about, or have questions, ask them about your questions, or join any organizational events. I just list a few local organizations that are nursing associations. Also, this event, like today, like this week, the Sound Careers in Healthcare events. By joining these events or talking to different healthcare professionals, you may have a better idea what we do in healthcare or different roles in healthcare. So that can also provide you some information. And I also encourage you to shadow. I think shadowing is a great opportunity for you to see what we do, such as what is it like what I share, what is it like to work to be in a community health setting. Every organization can be very different. So I encourage you to consider shadowing experiences, and shadow as many nurses you have the connection to, so then you have maybe a better idea of what you wanted to do or what you would like to do in the future. And lastly, volunteering. I personally have joined lots of volunteer experience, and that's where I found my interest when I was in high school or early college. I got to know that I love working with people. I love that I can build connections. So that's why I really wanted to join a career that I can be with people, working with people. And I listed a resource here, the Seattle King County Clinic. It is available every year. During the pandemic, it was not available for the past 2 years, but I know that this upcoming fall, they will have another big event take place, usually in the Key Arena. It's a a week events that providing free medical care for community members that who need medical help, and they accept volunteers. This event functions because of volunteers. So I encourage you to check it out if you would like to consider yourself, envision yourself working in healthcare in the future. And I think this is an excellent opportunity to start. And I have more time. I will accept any questions if you have any. Have you worked with children? Any special consideration when working with kids? So yes, I have worked with many children. I would say when working with kids, there are definitely difference when it's working with adults, because usually whether it's in person or on the phone, you usually work with their family members or parents or guardians. So listening to, I think when you work with them, listening to the parents' concern or family members or the guardian's concern is very important, but also if you have the kids doing the triage in person, also looking at the children, looking at the kid is very important, because sometimes you can tell whether the kid is sick or is not sick, whether the concern is really because family members are very anxious. So it definitely can tell you cues about the specific concern that they have. And when working with kids, I think another thing is need to be very creative, because it's not easy to just, sometimes they can't really communicate their feelings, or they don't even have the capacity to. So I think it needs to be very creative when you work with them. Lots of times I have found bringing a sticker really helps, or giving them a book or toys. Those are really helpful things that when you can have the child be more interactive with you. I think when we give medication to children, that's really hard, because they really don't want you to give them a shot or giving them medication. So lots of times having parents be there supporting, and also like bringing some of the tools that can help you, like what I said, stickers, the toys or books. Those are very helpful things. Next question is, will you consider different positions in future, like an instructor? Yes, absolutely. So right now I am getting my doctorate degree in nursing practice to become a nurse practitioner. So definitely will be becoming a nurse practitioner in the future, but I do really would love to consider in teaching. I really believe that I have lots of great mentors in my journey of becoming a nurse, and I have found like who I am today. Really, I got lots of supports from the teachers, the mentors that I have. So I would love to definitely in the future returning to academic settings and become an instructor. And someone asked, will you talk a little bit about the career path as an RN in ICHS? Is it like why I chose this organizations, or can you elaborate this question a little bit more?
I mean, like the growth and learning opportunity in the ICHS. Yeah.
Oh, I see. Yeah, so I would say starting as a new grad in a primary care setting is a challenge, because in nursing school, I think current curriculums really train nurses to be more confidence, or we learn lots of skills, but it's more serve us more in an inpatient setting. So as a new grad, now looking back 4 years ago, starting a job in a primary care settings without knowing a lot about how to triage a patient, or knowing what does it look like being in a primary care setting, it was very challenging. However, I have found that this organization that I'm in has been very supportive in my learning. I had very good preceptors that really share with me and walk me through the training process of getting me trained to be more comfortable talking with patients through the phones or in-person triages. So that I received lots of trainings in terms of how to use the medical record systems. Also, right now, I think our organization trying to provide more training in terms of different topics. So like last month, we received a educational sections in diabetes management. And so that was very helpful in terms of growing my skills in learning more about diabetes management. Also, this organization really encourage you to consider leadership roles, for example, joining different committees like the QI committee, the quality improvement committees, or right now I am part of the CI, the clinical informatics committee, which they encourage you to kind of contribute because we are all really essentials in the organizations, and lots of decision makings from the leadership team really based on kind of where we are as nurses. So they took our voices into considerations. So definitely I would say it has been very positive. And I think working in a primary care setting at ICHS really also helps me and allows me to grow and also know what does it look like being a provider role in the future, because I work with lots of nurse practitioners. I got to learn how they work with patients, and because I got to see a variety of patients every day when I work as a nurse. So I get to be more comfortable and knowing what does it look like in the future when I become a nurse practitioner. What are the benefits of having a mentor? Ooh, this is huge. I think benefits of having a mentor. One is this will be a person that you can seek advice for, or different. I have needed advice from mentors in a variety of settings. For example, what should I do in terms of future plannings? Like, should I remember asking a mentor, should I go back to school for a nurse practitioner? That's something that I really wanted to do. Should I do that now, or should I do it in 2 years? Also, I think mentors really are able to give you feedbacks on things that you may not see from your perspective. It really helps you reflect and also give you the constructive feedbacks that you need in order to grow. And also, I think you also learn from each other. I have heard from mentors that they learn from me as well as a student, versus I learn from them as my mentor. So I think there's lots of benefits of having mentors, and I encourage students to definitely seek mentorship when you can, and be bold to ask questions and seek mentorship. And I think I have 5 seconds left. So thank you everybody for joining. I appreciate your time.